Hi, I'm Maxine McCullers. Today I'm going to do an assessment of the abdomen on a young man. Prior to the assessment, I visited him, I identified him, I reviewed his chart, I reviewed his medical history, his family history, and now I'm going to move on to doing the assessment. This is Nurse Maxine. Today I'm going to do an assessment of the abdomen of this young African American boy. Prior to this stage, I had entered the room, knocked, I washed my hands, and I asked permission to enter his room. I have him in a position for my assessment. He's laying supine with his arms extended down his side. Prior to the assessment, I spoke with him about his family history. We spoke about history of family with colon cancer, irritable bowel syndrome, GERD, as well as his own history of any previous GI conditions, and he has denied them all. He is a healthy young man. Alright, so I'm starting here with inspection, and I start with inspection because you do that first in order not to obscure your sounds. So I am looking at his overall abdomen right now. I am looking for shape, contour. I'm inspecting the skin, making sure everything is even and the same throughout. I'm looking at his umbilicus, looking at the position. It should be midline and center of the abdomen. Looking for any drainage, looking at the skin color, integrity, markings, looking for any rashes, lesions, open areas, and everything on his abdomen looks well right now. I'm also observing his respiratory pattern to see if he is using his abdominal muscles to breathe. He seems nice and calm, and everything seems even. Included in my inspection, I'm looking for aortic pulsations or peristaltic waves. Everything appears to be normal. I am moving on to the auscultation. I will auscultate all four quadrants. Bearing in mind, if I do not hear sounds in either, I will listen for 5 full minutes over each area. I should hear at least 5 to 30 gurgles or clicks in each minute. I have already cleaned my stethoscope, so we're going to move on to the assessment. Okay, Nick, you will tell me if you're feeling any tenderness, any pain while I go through this assessment. So we start with the first quadrant. Nice and active. Active sounds. Very good there. Okay. Everything sounds normal there. I heard active bowel sounds in all 4 quadrants. What could be abnormal could be hypoactive or hyperactive or none at all. In his case, I was able to auscultate active sounds throughout. We are going to move on to the vascular sounds, which is auscultating the arteries, listening for bruits or hums. We'll use a bell of the stethoscope for this. Also, I'm going to be listening for friction rub as well. So we start here with the right renal artery, using the bell. Moving clockwise to the aorta and the left renal artery. Down to the left iliac artery and right iliac artery. And Nick, with your permission, I'm just going to go a little bit further down to auscultate your femoral artery, right, and femoral artery, left. Okay, there's absence of any bruise, friction rub, or hums. So, okay, now we are at percussion, and Nick, I'm going to ask you to breathe normally, and again, you will tell me if you have any pain or tenderness as I go around your abdomen. As I percuss, I should have tympani moving on to dullness, and then dull I will hear over the organs, the liver and the spleen. I'll also stop and measure the liver during this section. Alright, Nick, here we go. Using the middle finger, and move systematically around the abdomen. Okay, all sounds good. Again, this is a healthy young man. Alright, let's measure the liver. I will start by going to the mid-clavicular third intercostal space. We'll start it, and we're going to percuss until we hear the first dull sound. And I think that's right about here. We're going to make a little mark, okay? And then we'll start below at the level of the umbilicus and move upwards. There's tympani there, and moving up to dull right here. And this should be between 5 to 10 centimeters. So we will measure. And his measurement is 5 centimeters. So that wraps up my percussion. Final stage of this assessment, Nick, I will be palpating your abdomen, which is I'll be going around and lightly feeling all around, first lightly and then a little bit deep, but I'll let you know when I'm going to be doing deep. I will go deep just to check on your liver. Alright, so we'll start again, and always using this clockwise system here. I'm just feeling any masses, bulges, I should not be able to feel any of the organs at this point, and if I am feeling them, then there's enlargement. So everything here feels very good. And Nick, are you having any discomfort at all while I'm doing this?
No.
Okay. I'm even going over to center here to check on his umbilicus. Everything looks normal there. It's in line with the abdomen. No drainage, no protrusion. Can you take a deep breath in and out for me? Okay, checking to see if there is a presence of any hernias, and all seems to be well there with palpation. Nick, I'm going to do deep now. I both hands, and I'm really going a little bit deep here. And I'm not feeling anything protruding. Okay. Nick, I'm going to palpate your liver. I'm going to have you take a deep breath on the count of 3. Ready? 1, 2, 3. Deep breath. Okay, and exhale. Very good, you did great. Okay, Nick, you will take a deep breath again after the count of 3, and I will palpate your spleen. So 1, 2, and 3. Deep breath. And exhale. Okay. I was not able to feel his spleen, so it tells me he does not have an enlarged spleen. Finally, I'm checking for rebound tenderness. Nick, you will tell me if you have any pain at this point. Okay, we're just going 90 degrees with the finger. Now, do you feel any pain, Nick?
No.
And I'm going all around. Any tenderness? Anything hurts?
No.
Okay, there's no rebound tenderness. And that completes my assessment of the abdomen. Have a good afternoon.